Bismillahirrahmanirrahim, dear viewers and my dear colleagues. My name is Dr. Wakar. I have recently cleared NlE 2 on a very first attempt and without academy. In this video, I will tell you how to you can clear and pass the NlE 2 without academy. So this is actually the continuation of previous video. If you haven't watched my previous video, you go to my YouTube channel, Dr. Wakar. You can watch that video there. In this video, first I will tell you what are the common cases you have to prepare, and at the end I will tell you uh, what are the contents and books you can follow for the exam. So the first thing and foremost thing, before entering into the exam, you should have a basic clinical knowledge of all the major subjects like gynae, pediatrics, surgery and medicine. So then comes the gynae station. I will start from the gynae stations. In gynae station, you should be able to take proper history from the patient, start from the greetings, biodata, chief complaints, presenting history. After that, you must take obstetric and gynae history, and then past history, and then comes the rest of history. The main trick here is you should not forget to take uh, obstetric and menstrual history, especially in gynae. And the common cases which you should prepare for gynae is like pervaginal discharge, history of pervaginal discharge, and endometrial carcinoma, and abdominal mass like fibroid. So these are four STDs, for the three four things you should prepare for gynae station. The next thing comes surgery. For surgery, you must be able to take history. History is same in gynae and surgery. Um, and the common cases which you should prepare like acute cholecystitis, intestinal obstruction, colorectal carcinoma, and carcinoma of stomach, acute pancreatitis, renal calculus. These are the common things which usually comes in surgery station, and you must be able to uh, you must be able to know all these things and uh, manage these cases. And breast cancer and Berger disease, as you also know, Berger disease and breast cancer and its management all. The next thing comes the medicine. And medicine, you must be able to recognize the common x-rays of consolidation, pleural effusion, pneumothorax, abdominal x-ray like intestinal obstruction, renal calculus, and pediatric like necrotizing enterocolitis. It is very important. And diseases like asthma, COPD, tuberculosis, you should prepare also these things, and how to use inhaler, and how to prescribe to a patient with asthma or COPD or anything. So first, how to prescribe, start from the biodata and then comes to the drugs. Do not start directly from the drugs. And also the BLS. BLS is very simple. I have already explained that in my previous video. You can watch it there. For pediatric station, you prepare the video of the history of febrile fits and for fever, which is commonly comes in pediatric station. Um, then comes the cardiology. For cardiology, you prepare the ECG of um, acute MI, supraventricular tachycardia, complete heart block, atrial fibrillation, and you should be able to write down the findings of this ECG and its management. You should know all these things. So the next thing comes from where I should prepare. You all must have DIMS step 3 notes. Study it from first page until last page. Remember it's everything. Revise it and revise it. Revise it rapidly, and after studying any examination, any system, you should perform the examination over a patient or over a neighbor or brother or over a pillow or anything. And along with DIMS step 3 notes, you should watch videos on YouTube. There is a channel name, its name is Medi Learning. There are almost 50-60 videos, but the most important videos which you can watch is about the examination. It will also give you extra points, and it will also cover your viva questions. So DIMS step 3 notes, Medi Learning videos. And for pediatric, you should watch rapid revision of pediatric by Dr. Anand Kumar. There are 3-4 videos. You can watch it on 2x speed if you have background knowledge of pediatric. And then for gynae, you can watch the rapid revision of gynae and obstetrics by Dr. Shakshi Arora. On YouTube, you can watch her videos. There are 3-4 videos, almost 3 to 4 hours. You can watch it on 2x speed over YouTube. So it will cover all your viva questions and also the stations. But history and examination, it needs practice is the key. Next thing comes counseling. Counseling is very simple. You just go to the patient and mm, first do greetings. After that, you should ask the patient to that you presented to us with these complaints, and what do you know about your disease. After that, you just explain about the disease, its complication and its management. It is, and at the end, if it is like surgery case, orthopedic case or gynae case, you should refer it to the relevant ward. So this is all about counseling. And the common question, viva questions, I have explained that in the previous video. You can watch my previous video. And if there is anything regarding NlE2, you should put down your questions in the comment section. And inshallah, I will try my best to answer all of you. Thank you.